One Montana resident told us she's frustrated at the change in the phases of the state's COVID-19 vaccination plan. She's 68 and her husband is 76. Under the updated plan, she may have to wait an additional 6 months for a vaccine than originally anticipated.
That's what has been on the CDC guidelines since the jumpstart.
A December recommendation from the Centers for Disease Control and Prevention provided guidance for states when doses of COVID-19 vaccines are limited. That recommendation includes sorting people over the age of 75 into Phase 1B and anyone between the ages of 65 and 74 or with underlying medical conditions into Phase 1C. This is also due to the fact that vaccines are just simply not rolling out as fast as they anticipated.
Well, yeah.
Is that frustrating to hear?
Of course it is. Of course it is.
In mid-December, former Governor Bulk announced that the state's anticipated allocation of vaccine doses had been reduced by 20%. We reached out to the CDC to find out why the 65 and older group had been split into 65 to 74 and 75 plus. They sent us a statement that reads, in part, vaccine allocation to people 75 years and older is supported by their high risk for COVID-19 associated morbidity and mortality and is anticipated to also reduce hospitalizations in this group, easing the burden on strained healthcare systems. They also said cumulative evidence of COVID-19, cumulative hospitalizations, and mortality rate among people 75 and older were higher than people between the ages of 65 and 74. Yet people like Wendy are still concerned. She says she's reached out to the state, but hasn't heard back.
Thanks, Matt. And we plan to bring Wendy's concerns to the Montana Department of Public Health and Human Services. If you have questions as the COVID-19 vaccination plan evolves and changes, you can email them to us.